Welcome back. This is Living to 120 Beyond. I'm Jeff Harrison, your host. I'm here with
Dr. Edmund Chein.
Dr. Chein, you know, in our last episodes, we've been talking about the real causes of things like hypertension, known on the street as high blood pressure. And there's a process where we think, you know, we go to the doctor and we take the medication and it controls it. And I want you to talk to us about the difference of curing and controlling us, because there's a distinct difference, especially when we come to see someone like Dr. Chein, isn't there?
Yeah, absolutely. You know, I always wonder when we take an automobile that's overheating to a mechanic after a couple of times, we're gonna yell and say, "Hey, you didn't take care of my problem. This is the third time I'm back. You can't cure it. Let me know. Let me go to somebody else." When we treat our body, we're like idiots. We go back to the doctor. Oh, when's the next visit? To check my blood pressure, and I'm still taking your drug, by the way, for 3 years now. I'm just checking. I know it's been normal, but I've been taking it. When I don't take it, it goes high.
Yeah.
So when you stop seeing the mechanic, your car overheats. Is that a cure or is that a control? It's a control.
Sure.
It's not a cure. Cure means you never have to go back again.
That's true.
And that's the attitude I want our audience to have. To the extent of, I always say, bring a lawyer with you. Bring a lawyer to your mechanic. Hey, this is the last time I come to you. Okay? Do whatever you do. My car better not overheat, because if he overheats, he's going to sue you. Because I want you to promise that it won't happen again.
Yeah.
Within a reasonable time. 12 months is reasonable, isn't it?
Yes.
To fix an overheating problem.
You bet.
See, that's what I want people to do it to their doctors. To have a goal. What are you doing to me? Okay, if the mechanic tells you, hey, every time you come back, I just, control your overheating. I told you control only, okay.
Some more duct tape on.
Hey, yeah, we put the, hey, that's okay, that's fair. I told you. So if the doctor tells you, hey, I only control your blood pressure, that's fair. But you have to be the person that I want cure. I want cure. And cure meaning whatever time period you take, no problem, tell me. I put it on writing, you sign it, and after that, no more medicine.
So let's say, for instance, okay, I'm going to use my mother-in-law as an example. It's probably going to get me in trouble with my wife, and you know my wife. But anyway, she has a host of medications she has to take, right? So she really, by your definition, and now my definition too, is she is being controlled by her doctors.
Absolutely.
Because they're not doing, without being slanderous or libel, they're not doing anything to cure her.
Exactly.
They're only controlling things.
Exactly.
And in a few episodes, our first episode, you talked about, hey, if you have a doctor who is only giving you things that are controlling you, specifically for high blood pressure and hypertension, you're saying that doctor is not up to date.
Not up to date.
So I don't want to say that's true, or maybe you can. Is that true across the board?
Across the board.
Okay, so you're saying there's, and I remember when we first met a long time ago, I asked the question, and I'm just going to put it on tape again, is you said, or I asked you, are you saying there's no such thing as a terminal disease?
There are terminal diseases like cancer, extensive stage 4.
Okay.
But diseases in the beginning, there's no terminal disease. There is, when you catch the disease in the early stage, to me, it's all curable.
Instead of controlling it, and then it becomes out of control.
Correct.
Now it becomes a terminal disease. Is that fair enough to say?
That's fair enough to say.
All right. Because I want our listeners to understand it from not only I'm going to say the medical side, but also from the layman side. That hey,
yes,
we just get up and go to work every day, and we don't have the schooling behind us. And so what you're saying is, if my mother-in-law, as an example, she comes to her doctor and she has all these medications, you're saying, hey, that doctor's not trying to cure her. He's trying to control her through medication. Is that fair?
That's absolutely fair.
Now, again, I'm going to maybe put you on a spot here, but not knowing my mother-in-law and all that's going on, you're saying there's a good chance that with the right diagnosis that those could be cured and she could stop taking all those pills.
No, the diagnosis is correct. High blood pressure diagnosis is correct. It's the way the doctor treats that hypertension or high blood
Okay.
pressure. That's wrong.
Gotcha.
In other, what he should have done is, yes, give you some pills to control the pressure. At the same time, investigate the cause. What caused you to have the high blood pressure, and eliminate the cause. Once the cause is gone, high blood pressure is gone too.
You know, wouldn't that be the goal of every physician when they walk in, when somebody walks in and they have, again, we're just going to use high blood pressure because we've been talking about that hypertension, to not just control it, but to cure it?
Absolutely. But you see, when I went to medical school in the 70s, we weren't taught that way.
Okay.
We were taught to give pills to control.
Okay.
Everything was control. Control the symptoms. Allopathic medicine is treating the symptom. You got blood pressure, I bring that down. You know, you got pain, I take that pain away. I don't say why you get that pain. I don't ask that question. That's why there is a field for chiropractic. They go in to fix the spine and take away the pain, the cause of the pain. You got back pain, you go to a chiropractor. You don't go to allopathic medicine. He's going to give you a pain pill, anti-inflammatory,
True.
and you take that pill. He doesn't even touch you.
Yeah.
You see,
point.
that's the difference. So what I'm saying is that many of us today, and I'm in my 60s now, many of us were trained in the 70s when we were taught by our medical schools to treat the sign, the symptom, not the cause at all. Now, if you kept up with the signs, okay, if you go to seminars and conventions, you keep up, then it's at the conventions and seminars and doctors' meetings. For example, the functional medicine, there's a group of doctors now. They go for the cause. And that's where you learn that these doctors, the allopathic doctors, MDs, will learn, oh, it's curable. Yes. So that's different.
So you're starting to see a blend of the doctors like yourself that see beyond the I'm going to call it the control
Of the symptoms.
of the symptoms versus
Yeah.
curing the
Right.
symptom or curing the problem,
Yeah.
going back to the cause.
Right.
Okay. All right.
You know, I want to ask the viewers actually, if you have blood pressure and you're taking a pill, take that pill out right now and look it up on Google, okay? It's either a diuretic, means pee out the water. Oh, your blood pressure is high, let me get rid of some water so you have less blood and the pressure drops. Oh, that's smart. Is that a way to treat hypertension?
So that's like saying the balloon is full of water,
Let
too
some
much
out.
pressure, let some out, and it's cured.
That's not, you just let out some water. Diuretics, all the time, people, wrong, okay? Next thing, you know, vasodilators. Oh, your hose is too tight. Let's dilate your hose. Is that treating the cause? No. Okay, let's go to Home Depot, buy a bigger hose that's 10-inch big so you have no pressure. Is that treat the way to treat vasodilators? Is that the way to treat? No.
You call them
Vasodilators, artery dilators.
Okay. All right.
Go to Home Depot, a bigger hose. Is that a treatment? No. Okay. They have angiotensin ACE inhibitors. Oh, your kidney. By the way, our kidney controls our blood pressure. It's a very complex system with the angiotensin system. Oh, let's attack that. Okay, you got your hose hooked up to some kind of software in your house that can adjust. Okay, let's deal with that software. So your hose can go any way you want with the software. Is that the way to cure? No.
Again, it's just controlling it.
No, just controlling.
But we on the street, again, laymen are thinking, hey, you know what? Now I come back to you, if you were an allopathic doctor, and now I test my blood pressure again, and now it's back to normal. Hey, this is working. Why would I get off of it, right?
And this question,
so we're
Doc, how long do I have to take this?
That's the key question.
That's the key question.
How long do I have to take this?
How long?
Okay.
Here's the contract. Please sign it.
Yeah.
Whatever years you say, I go. But put it down. How many years? And the answer, if it's an honest one, lifetime. Hey, doctor, I don't come to you for a problem that you cannot cure, doc.
Right.
Tell me.
But now, wait a second. Now, it's one of those things that people will tell you, hey, it's in your genes, or it's, you're getting older. It's just the way it's going to be. I mean, has that ever happened? I mean, let's be honest. I mean, you go to the doctor and says, well, you know what? Sorry, you're just getting older. This is part of life.
Thank you, doctor. Just tell me you cannot cure. Tell me in English. Don't blame my gene. Don't blame my mother. Don't blame my dad. Okay? Don't blame my diet. Don't blame that I'm fat. Okay? Just tell me you cannot.
And then you go.
And the way you're going to treat me is put me on this pill for the rest of my life. You tell me that, I leave.
Well, that makes me, that kind of brings back a thought process where I've had friends who have gone to the doctor and they've gotten a diagnosis that they didn't like. And so they just kept looking for a doctor who all these other doctors says, hey, it's incurable. It's just the way it is. And then they found somebody like you that said, we can fix it. Let's get to the cure. Let's get to the cause. And it has saved their life.
Yes.
So, but let's face it, you're the expert. Mm-hmm. When you tell us, when we go to the doctor, you have the stuff on the wall, the documents on the wall that says you know this. Yes. And so we believe you. You're our authority figure. Yes. We believe you. But you're saying now, it's time to really I don't want to say be disruptive, but challenge that decision, challenge that comment, and say, and what you're saying is put the contract in front and say, okay, is this a cure or is it a control?
Correct.
And if it's a control, I'm out of here. If it's a cure, how long do I have to take it before I'll never have to take it again? Yes?
Right. And this is the information age.
True.
We've got the computer.
Well, we have the ability to do like what we're doing now. We're actually exposing information that before we didn't hear about. We couldn't even access it.
And how's the audience getting this information? Through information technology, internet.
Yeah.
Without internet, they would be just as dumb as before the speech.
That's true. They'd still be under control.
And if they can listen to this, they can use that computer and search out the answer for high blood pressure. They need to educate themselves. What is it? What are the causes for it? And is there a cure for that cause?
Yeah.
Information is important. Doctors cannot hide anymore. They are no longer God. Used to be God, because like you say, you got a diploma, I don't. There was before the days of computer. Now, with the internet, nobody can be a fraud for very long.
That's true.
I cannot be here for very long if what I speak wasn't the truth.
Yeah. So here's what we want to do. We want to challenge you to go to your medicine chest.
Yeah.
And we want you to open that up and look, and then close the door after you pull out your medication and ask yourself, am I being controlled or am I being cured?
Exactly.
We look forward to joining you again next time on Living to 120 and Beyond. I'm Jeff Harrison.
Dr. Edmund Chein.
Thank you.